My doctor visit costs $12 abroad. Here's what your Medicare won't cover, and what actually works. I want to start today's video with a number. $12. That's what I paid for a doctor's visit. A real, sit down, take your time. Ask every question you have doctor's visit. In a clean, modern, private clinic. With a doctor who spoke English. And didn't look at the clock once. $12. Now, I want you to think about the last time you saw a doctor back in the States. Think about what you paid. The copay. The deductible. The bill that showed up 3 weeks later for something you didn't even know you were being charged for. The average out-of-pocket cost for a single doctor's visit in the United States is somewhere between $250 and $500. Depending on your insurance. Depending on your plan. Depending on how your day is going. And here's what I really need you to hear today. If you have Medicare and you're thinking about retiring abroad, or even just spending significant time outside the United States, there are things your Medicare card will not do for you. Things that most people only find out about after they need them. And I want to talk about all of that today. The real stuff. The clear, calm, no panic version. Because once you actually understand how this works, it's not as scary as you think. There's a real solution. And it's more affordable than you'd ever guess. So, let's get into it. Section 1, the truth about Medicare abroad. Let me just say it plainly. Medicare does not cover you outside the United States. I want to say that again slowly, because it matters. Medicare does not cover you outside the United States. This isn't a loophole. This isn't a technicality. This is official policy directly from Medicare.gov. Medicare Part A, that's your hospital coverage. Medicare Part B, that's your doctor visits and outpatient care. Neither one covers medical services you receive in a foreign country. In most situations. Full stop. Now, there are a few narrow exceptions. And I mean narrow. If you're traveling through Canada, on the most direct route between Alaska and another U.S. state, and you have a medical emergency, and a Canadian hospital is closer than the nearest U.S. hospital, Medicare may cover that. Or if you're in the U.S. when a medical emergency begins, and a foreign hospital just happens to be closer, Medicare may cover that too. But those are edge cases. Rare situations. If you are living abroad or spending months abroad, those exceptions don't really apply to your everyday life. And here's where it gets even more important to pay attention. If you have Medicare Advantage, that's Part C. The kind offered through private insurance companies. You need to be very careful. Most Medicare Advantage plans require you to live within a service area. And here's the part that catches people: if you travel outside the U.S. for more than 6 months, some plans can actually disenroll you automatically and return you to original Medicare. 6 months. That's not a lot of time if you're thinking about spending a year or 2 living abroad. And your prescription drugs? Medicare Part D, your drug coverage, does not cover medications you purchase outside the United States. Not even close. If you need refills while you're living in Portugal or Mexico or Greece, you pay out of pocket. Now, before anyone starts to panic, I want to tell you something that actually made me feel much better. When I first learned all of this, the medication situation abroad? In most countries, it's not the problem you think it is. In Mexico, in Portugal, in most of Europe, the medications themselves cost a fraction of what they cost in the States. Many things you pay $80 or $100 for in the US cost $8 or $12 abroad. Without insurance. Just off the shelf. But let's keep going. Because the real question is, okay, Medicare doesn't cover me. So what does? Section 2, what Medigap actually does and doesn't. Now some of you might have a Medigap policy. That's Medicare Supplement Insurance. Plan C, D, F, G, M, and N. And if you do, there is some good news here. Some of those plans do offer limited coverage for foreign travel emergencies. Here's exactly how it works. If you have one of those Medigap plans I just mentioned, and you have a genuine medical emergency, and it happens within the first 60 days of your trip abroad, those plans will cover 80% of eligible emergency expenses after a $250 annual deductible, up to a lifetime maximum of $50,000. So that's genuinely useful. If you're traveling, if it's an emergency, if it's within 60 days. But here's the reality. If you are planning to live abroad, not vacation, but actually live, 60 days goes by very fast. And $50,000 lifetime maximum. In a real medical emergency, a cardiac event, a bad fall, a stroke, that cap can be reached. So Medigap helps. It's not nothing. But for someone who is truly relocating abroad, it's not your primary solution. It's a supplement to a supplement. And that brings me to what actually works. Section 3, what actually works, private international health insurance. Okay. So if Medicare doesn't cover you abroad, and Medigap only covers emergencies in the first 60 days, what do people actually do? They get private international health insurance. And I know that sounds expensive. Because in America, private insurance is expensive. It's just, we've been trained to expect it to cost a lot. Because in America, it does. But here's where the mental shift happens. International health insurance, purchased locally in the country where you live, or through an international provider, costs a fraction of what U.S. insurance costs. And I'm not talking about a small fraction. I'm talking about a dramatic difference. Let me give you real numbers. In Portugal, private health insurance for a healthy adult in their late 50s or early 60s runs between 30 and 150 euros a month. That's roughly $33 to $165 a month. And at the mid-range of that, you're getting coverage that includes doctor visits, specialist referrals, hospitalization, and lab work. In Mexico, a comprehensive private health insurance plan for a 60-year-old can run between $80 and $150 a month USD. Some people pay less. Some people pay more depending on coverage level. But that's the realistic range for solid, reliable coverage. In Spain, private healthcare insurance can run as low as $75 a month, with no co-pays, covering a wide range of treatments. Compare that to the average American paying $500 to $800 a month for private insurance before Medicare kicks in, or paying significant Medicare premiums for coverage that doesn't even follow them across a border. The math is striking. And it's not just the price. This is the part that surprised me the most, honestly. And I've heard it from expat after expat in country after country. The experience of healthcare abroad is different. In Portugal, and I've heard this from so many people, doctors take their time. They're not rushing you. They're not watching a clock or managing 6 other patients simultaneously. The relationship between a doctor and a patient there feels more like it used to feel here, a long time ago. In Mexico, particularly in cities like Mérida or Guadalajara, private hospitals are modern, well-equipped, internationally accredited. Many doctors did part of their training in the US or Europe. And a general doctor's visit runs somewhere between $3 and $25 US. A specialist consultation, around $43 to $55. That's not a typo. A specialist visit, $43 to $55. Cash. No insurance needed. No prior authorization. No 3-week wait. And lab work, comprehensive blood panels, imaging. Often under $55 total. In Greece, which was just ranked the #1 retirement destination in the world by International Living's 2026 Global Retirement Index. Healthcare is accessible, affordable, and expats consistently describe it as a high-trust experience. You feel like a person, not a billing code. The World Health Organization, for what it's worth, ranks France #1, Italy #2, Spain #7. In overall healthcare systems worldwide, the United States is ranked 37th. And yet we pay more per person for healthcare than any other country on Earth. According to recent data, U.S. healthcare spending per capita is around $12,742 per year. Per person. That number alone is worth sitting with for a moment. Section 4, the Medicare decision, what to do before you leave. Okay. So let's say you're seriously thinking about this. What do you actually do with Medicare? This is where it gets a little nuanced. And I want to walk through this carefully, because the decision matters and it's personal. First, Medicare Part A. For most people, Part A is premium-free, meaning you don't pay a monthly fee for it, because you paid into it through your working years. If that's the case for you, most experts and expats I've talked to say, keep it. Just keep it. It costs you nothing, and it means that whenever you come back to the United States, for a visit, for a family event, for anything, you have hospital coverage. Right away. No gaps. Now, Medicare Part B. That's where the real decision comes in. Part B has a monthly premium. In 2024 and 2025. That's been running around $174 to $185 a month. And Part B, as we've talked about, does not cover you abroad. So the question is, are you paying $174 a month for coverage you can't use where you're living? The answer depends on how often you come back to the U.S. If you plan to spend several months a year back in the States, visiting family, handling things here, it may be worth keeping Part B. Because if you let it lapse and then return permanently someday, you could face late enrollment penalties. And you'd have to wait for a general enrollment period, which only runs from January through March, with coverage starting later. That gap in coverage, that waiting period, is something you really want to avoid. So the practical advice from most expat healthcare consultants is this. If you plan to return to the U.S. regularly or possibly permanently someday, keep Part B. Think of the premium as insurance against those penalties. And that enrollment gap. If you are genuinely, truly, permanently relocating abroad, with no plans to return, then the math might favor dropping Part B. But get personalized advice before you do that. Every situation is different. And if you have Medicare Advantage or a Part D drug plan, you should generally disenroll from those when you move abroad, because those plans require you to live in their service area. You'll be paying for something you can't use. And as I mentioned earlier, some plans can actually disenroll you automatically after 6 months outside the country anyway. Section 5, the practical setup that actually works. All right. Let me pull all of this together into what an actual, workable healthcare setup looks like for an American living abroad. This is what I see working for the majority of expats I've talked with. Not a theoretical answer. The real-world answer. Step 1. Get private international health insurance, or a local policy in the country where you'll be living. For most popular retirement destinations, Portugal, Mexico, Greece, Spain, Costa Rica, Colombia, you're looking at $80 to $200 a month for solid coverage. Sometimes less. Look at providers like Cigna Global, Bupa Global, or local insurers in the country you're moving to. Local policies are often significantly cheaper. and more than adequate for routine care. Step 2. Keep a real emergency fund. Even with insurance. Understand that private hospitals in many countries require an upfront deposit for non-emergency procedures. It's not like in the US where you can sometimes sort out payment later. They may ask for the equivalent of $300 to $5,000 upfront, depending on the situation and the hospital. Having liquid savings accessible is important. Step 3. Bring your medications. And bring enough. Work with your doctor before you leave to get a 90-day supply of anything you take regularly. Bring original bottles. Bring a copy of your prescription. In most countries, many medications are available at dramatically lower prices without a prescription. But some countries have import restrictions on certain drugs, especially controlled substances. Know the rules for wherever you're going. Step 4. If you're a military retiree, talk to someone about TRICARE for Life before you make any decisions. TRICARE for Life actually does provide coverage abroad. It covers Medicare's deductibles, co-payments, and co-insurance. And it offers additional benefits outside the US. That's a genuinely different situation and a real advantage if you qualify. Step 5. Talk to an expat health insurance consultant, not a general insurance agent. Someone who specifically works with Americans living abroad. They know the options. They know what works in different countries. And a 1-hour conversation can save you a lot of confusion and a lot of money. I want to end today with something simple. I know healthcare is the big one. I know for a lot of people, it's the thing that sits at the very center of the decision. I'd love to do this, but what about my healthcare? And what I hope today's video gave you is a clearer, calmer picture of what the reality actually looks like. Medicare stops at the border. That's true. And it matters. But it doesn't mean you're unprotected. It doesn't mean healthcare abroad is risky or unreliable or scary. In most of the places Americans are choosing to retire, the healthcare is good. Often very good. The doctors are trained. The facilities are modern. The experience is, honestly, often better than what we get at home. And the cost? Well, you heard the numbers. $12 for a doctor's visit. That's not a fluke. That's not a lucky day. That's just what healthcare costs in a lot of the world. And private international insurance to cover the bigger stuff? $80 to $200 a month. Compared to hundreds of dollars a month. For coverage that doesn't follow you past the border anyway. The healthcare piece of this puzzle is solvable. It really is. If this video helped you see that more clearly, I hope you'll subscribe. Because I'm going to keep making videos like this one. Calm. Data-backed. Honest. No fluff. No agenda. Just the real information. And drop a comment below. Tell me, what's your biggest healthcare question about retiring abroad? I'll answer as many as I can. And the most common questions might just become future videos. Take care of yourselves. I'll see you in the next one.